Good evening, my dear friends. Welcome to my channel. Please subscribe to my channel. So today we are going to discuss about a very important triangle called as posterior triangle. So before going to see the PPT, let us see on the whiteboard about this posterior triangle. So we will have a very short time to see the boundaries on this whiteboard. So here we can see the midline structures of the neck, and this is the lower border of the body of the mandible. Then below the body of the mandible, exactly at this point, we can identify right and left mylohyoid muscles which are present. They are connected in the midline called as mylohyoid raphe. Below that we can identify the hyoid bone. Then we can see the thyroid cartilage, then thyroid gland. Then below this, it is reaching these midline structures which are present here are the muscles, strap muscles, and below here you can identify the jugular notch or suprasternal notch. Then already we have seen this all four triangles which are the subdivisions of anterior triangles. Now we have come to this posterior triangle. So the posterior triangle boundaries are anteriorly we can identify posterior border of sternocleidomastoid, and posteriorly we can identify anterior border of trapezius muscle, anterior border of trapezius. And here you can see the apex which it is going to meet the anterior boundary and the posterior boundary, and this is the mastoid process. And here at the base it is formed by the clavicle. This is the clavicle. So entire this is the posterior triangle, and here you can see at the superficial strata we can identify this vein is called as external jugular vein. External jugular vein. And now coming to this posterior triangle, here you can identify the superior belly of omohyoid, which is dividing the anterior triangles, lower part of anterior triangles into two subtriangles. Posteriorly we can identify the carotid triangle. Then antero-inferiorly we can identify the muscular triangle. Then the inferior belly of omohyoid, which is running behind the sternocleidomastoid, and then it is appearing in the posterior triangle. And this inferior belly of omohyoid is separating the posterior triangle into two subtriangles. So the upper part it is called as occipital triangle. Occipital triangle. Lower triangle is called as subclavian triangle. Lower triangle is called as subclavian triangle. You can just remember this ST or subclavian triangle. So we'll just have a short discussion on this whiteboard, then we'll try to see the structures which are present in the occipital triangle in the PPT. Okay, so coming to this subclavian triangle, so below this inferior belly of omohyoid we can identify, and the boundaries of this subclavian triangle, anteriorly we can identify posterior border of sternocleidomastoid muscle, and then posterior superiorly we can identify the inferior belly of omohyoid muscle, and the medial 2/3 of the clavicle which is forming the base of the subclavian triangle. Why it is called a subclavian triangle? Because the structures which are present here, subclavian vein, subclavian artery, and the trunks of brachial plexus. This is the upper trunk, middle trunk, and the lower trunk of brachial plexus, and other structures which are present in the occipital triangle. Let us see on this PPT. Yes, coming to the occipital triangle. To understand the occipital triangle, I just want to show you how the omohyoid muscle is present. So already have discussed about the omohyoid muscle on the whiteboard, that how the two bellies are present and how they are connected by a tendon. So this omohyoid muscle, it is having two bellies, superior belly and the inferior belly, and the both bellies are connected by intermediate tendon. This intermediate tendon which is present exactly behind the sternocleidomastoid muscle. Yes, here we have removed the sternocleidomastoid muscle, and here clearly we can identify the superior belly of omohyoid, and then you can see the intermediate tendon over here which is present exactly behind the sternocleidomastoid muscle. Then the inferior belly appears in the posterior triangle, that it is separating the posterior triangle into superior occipital triangle, inferior subclavian triangle. This is superior belly. Then coming to the contents of occipital triangle. Contents of occipital triangle are: one is 11th cranial nerve, that is spinal accessory. Then the 3rd and 4th cervical nerves which are providing branches to the two muscles called as levator scapulae and the trapezius. Then the dorsal scapular nerve which is coming from the roots of the brachial plexus. Then the 4 cutaneous nerves which are coming from the cervical plexus, they pierces the deep fascia, investing layer of deep cervical fascia, and comes outside and pierces the platysma and comes outside still and pierces the skin and supplies to the skin. Then superficial transverse cervical artery, and occipital artery. These are the contents of occipital triangle which are present above the omohyoid. Yeah, here you can see this occipital triangle. The contents are occipital artery. Then you can identify the transcervical artery over here. Then dorsal scapular nerve. Then supraclavicular nerve, which is a C3, C4 branches which are piercing that and coming outside and supplies to the skin. This is a spinal accessory which is present exactly under the surface of sternocleidomastoid muscle. Here, the floor contents. Coming to the floor contents, from above downwards, you can identify semispinalis capitis, splenius capitis, levator scapulae, and the scalenus medius. So, four muscles you remember: SSSL, triple SL. Okay, remember the mnemonic triple SL, which are forming the floor contents of the posterior triangle: semispinalis capitis, splenius capitis, scalenus medius, and between the scalenus medius and the splenius capitis, you can identify levator scapulae. Then moving to the subclavian triangle or supraclavicular triangle. It is also called as supraclavicular because as it is present exactly above the clavicle, we can also call it as supraclavicular triangle. So already I have shown you the structures which are present in the subclavian triangle. The structures which I have shown you is subclavian artery, subclavian vein, then you can see the trunks of brachial plexus, and here in the superficial strata we can identify the terminal part of external jugular vein. Also it is involving in the content of the subclavian triangle. The superficial cervical, suprascapular, and dorsal scapular arteries, these are also the contents of the subclavian triangle and also the lymph nodes. Let me show you all the contents. Yes, here we can identify this is the subclavian triangle. The contents are, here you can see the subclavian artery, third part of the subclavian artery, subclavian vein. Yes, here you can see the trunks of brachial plexus. And here you can see the transcervical artery. These are the structures which are present in the subclavian triangle. Yes, coming to this, structures piercing the roof. So the roof is formed by skin, then the superficial fascia, then we can identify the platysma, which is a subcutaneous muscle, then the investing layer of deep cervical fascia. These are all the structures which are forming the roof. The roof is pierced by the structures. The nerves are, one is lesser occipital nerve, which is present exactly posterior to the posterior border of the sternocleidomastoid muscle. At the upper part of the posterior border of sternocleidomastoid muscle, we can identify this lesser occipital nerve. Then you can identify the greater auricular nerve, which is, it is also running, it is covering the sternocleidomastoid muscle. It is forming just like a loop. It is coming outside from the posterior border of sternocleidomastoid muscle and running over the surface of sternocleidomastoid muscle and pierces that and extends upwards and runs behind the auricle. Then transcervical nerve, which is running on the surface of the sternocleidomastoid muscle. It is exactly present posterior to the external jugular vein. Then the supraclavicular nerves, lower part of the skin over the neck and also to the pectoral region, it is supplied by the supraclavicular nerves. I am not telling you about the root value of each and every nerve, that you can study and understand. But remember, the structures which are piercing the roof are lesser occipital, greater auricular, transcervical, then supraclavicular. This is the supraclavicular nerve. Then they pierce the roof near the middle of the posterior border of sternocleidomastoid muscle. Okay, and then comes outside and supplies to the upper part of the neck is supplied. Upper part of the posterior triangle is supplied by lesser occipital and greater auricular. Middle part of the posterior triangle is supplied by transcervical. Lower part of the posterior triangle is supplied by the skin over the lower part of the posterior triangle of the neck. It is supplied by supraclavicular nerves. They already have shown you how the muscles which are forming the floor of posterior triangle, S3L, semispinalis capitis, splenius capitis, levator scapulae, and the scalenus medius. Then the nerve, from the trunks of the from the roots of the brachial plexus, exactly from the C5, we can identify the dorsal scapular nerve, and then from the C5, C6, C7, we can identify long thoracic nerve. Then from the upper trunk of brachial plexus, we can identify suprascapular and nerve to subclavius. So the trunks which we can identify in the subclavian triangle or supraclavicular triangle. Moving to the clinical aspects, the spinal accessory nerve may be damaged in operations involving the removal or biopsy of lymph nodes in the posterior triangle of the neck. This torticollis or wry neck, it is a clinical condition in which head is bent to one side and chin points to the opposite side. This occurs due to the spasm of sternocleidomastoid muscle at one side and trapezius muscles. Okay, both muscles, anterior and the posterior boundary muscles, which lost the nerve supplies. The spinal accessory nerve damage causes this wry neck or torticollis. Brachial plexus block. Brachial plexus in the posterior triangle is located below the line extending from the posterior border of sternocleidomastoid muscle at the level of subclavian triangle. Then, in this region, the brachial plexus can be blocked by injection of a local anesthetic between the first rib and the skin above the clavicle. So, the brachial plexus block is sometimes done to perform surgical procedures in the upper limb. Then, pulsations of the subclavian artery. It can be felt at the root of the neck by pressing behind the clavicle at the posterior border of sternocleidomastoid muscle. The hemorrhage from the arteries of the upper limb can be stopped by pressing subclavian artery onto the first rib, lateral to the lower end of the sternocleidomastoid muscle. That is the pulsations of subclavian artery. Then swelling in the posterior triangle. It is very, very important. The most common cause of the swelling in the posterior triangle is due to enlargement of the lymph nodes. The supraclavicular lymph nodes are commonly involved and enlarged in the TB, that is called as tuberculosis, then Hodgkin's disease, and malignant growth of breast, arm, chest. So any part of the abdomen, any part of the chest, or the arm, we can see the lymph nodes enlargement in the supraclavicular triangle or subclavian triangle. The left supraclavicular lymph nodes, also called as varicose lymph nodes, they are very important. They're commonly involved in the metastasis from cancer of the stomach, cancer of the testis, and cancer of other abdominal organs. So the biopsy of these lymph nodes is helpful in early diagnosis of distant malignancies. So that is about these are the clinical conditions of the posterior triangle of the neck. So with the new video, again, we'll meet you in the next class. Thank you, dear students.